Welcome back. This is Dr. Katrina Banks, physical therapist and owner of Neurologic Optimal Wellness Physical Therapy. So today we're going to be talking about the principles of neuroplasticity that was put in a research paper by Klein and Jones in 2005. So as you have had a stroke, most of you have had some type of rehabilitation. It may have started in the hospital and then continued as an acute rehab hospital, a subacute skilled nursing facility, and or at an outpatient clinic. Your insurance will certainly dictate your course of physical therapy. Insurance will allow a certain amount of visits while you're making progress, and then eventually decide to cut down your visits or cut therapy altogether, most times leaving you to continue therapy on your own. Most of you become a little frantic at the idea that you still have deficits from your stroke that you could improve upon. You continue to work on some of the exercises on your own at home and then that you were prescribed by your physical therapist. But do you know why you're doing the exercises you were prescribed? What changes are occurring within your brain? Have you been provided with the education and tools required to continue to improve your stroke recovery well enough so that you could apply them throughout your daily routine? You can do your exercises consistently, which is a great thing. But if you're not doing them in a purposeful and functional way, your progress may be slowed or a bit slower. So let's go over the principles of neuroplasticity. So the first one is use it or lose it. If you're not using your affected arm or leg or working on a particular skill, you're going to lose it. So you want to use it to get things going. The second one is use it and improve it. So your movement may not be pretty initially, but we must continue to use it for movement to improve. The third one is specificity matters. So when you're relearning to use your arm and leg, you need to practice that skill specifically. Repetition matters is the next principle. So when you learn a new skill, you must do that skill over and over and over and over and over. Like, this is very serious for your brain to rewire and make new connections. Intensity matters. So performing the tasks you have learned at a high intensity promotes neuroplasticity. So when your physical therapist is, pushing you to do a little bit more or push a little bit harder, that's where that intensity comes in. The next one, time matters. So rewiring of the brain can occur at different times during training. So in order to pick up a cup with your hand, you must develop grip strength first. The next one, salience matters. So the skill that you're learning has to be meaningful to you. So let's say you're a chef and you typically like to cook burgers on a grill. We need to incorporate you literally doing the motions required to relearn that skill. So when you, the patient, are learning a skill that means something to you, that promotes neuroplasticity. Age matters. So the younger you are, plasticity occurs more readily than in someone who is older, but don't let that stop you because plasticity does occur in the older brain. The next one is interference. Interference is you want to limit interference when learning a new skill. And basically try not to multitask, as adding components too early can take away from the skill you're learning. And then transference. Transference is once you have learned a skill and you're doing it really, really well, you can add another component. So the main focus, as it should be, in regaining is to regain your function and the ability to get in and out of bed, to stand, walk, climb stairs, maintain good balance and safety awareness. Yes, that is certainly a part of rehabilitation with the goal of getting you home safely. But you want to incorporate these principles of neuroplasticity. So thanks for listening. Check out the next video in which I will walk you through an example of utilizing the principles in stroke rehab. Thank you.